So we're going to go through their slides and videos, and we'll get to meet a fictitious family and see what they're going through, the Garcias, and how they're handling some issues that they're seeing with their mom. And along the way, we'll get to hear from some professionals with the Alzheimer's Association. And we will take questions through the chat along the way if you do have some questions. And then at the end, I will ask, of course, if anyone has any questions, and we'll open it up at that point. So if you do need to ask something along the way, feel free to just send it via the chat, and we will answer you from there. So we will get started. Okay. So bear with me, I know. Usually I'm not forwarding the slides, so I will make sure that I try to be on top of that as I'm talking. So the learning objectives for the presentation today are to describe typical age-related memory and behavior thinking changes, recognize some of the common warning signs, discuss tips on how you might approach someone, and explain the importance of early detection, benefits, and diagnosis, and identify tests and assessments that might be used, and name some of the resources. So the Garcias are the fictitious family that I mentioned earlier that we're going to meet. And so Mary is a 73-year-old widow. She lives alone. She's a retired teacher, and she's always been very meticulous, neat, tidy. But her daughters, she has 2 daughters, and they've noticed some changes, some things piling up and things not being taken care of as they always have been. Patricia lives in another state. She's not able to visit her mom as much as she'd like. She does communicate with her sister and her mom. And Lydia is the eldest daughter who does live close by. She's able to visit frequently. And they are a close family, and we'll get to see more of that and some of their concerns along the way here if things they're noticing with mom. So this is a series of text messages between the 2 sisters. I won't read them to you. I'll let you read them as they pop up. So through the text messages, they're saying that they're worried about their mom. They're wondering if it's normal, the things that they've been noticing, and that she's getting a little forgetful. So Dr. Salloway, we're going to hear what he has to say about it.
Rebecca, we're not getting the volume for Dr. Salloway.
You're not hearing it? No. Oops. Could you hear that at all?
No.
I wonder why. I apologize. I'm not sure why the volume or the sound isn't coming over.
I'm sure you've done this presentation many times. Do you have like a recap of what he had to say?
Yes. Although I don't have it all written out, so it's like trying to remember exactly what he said. So that's like, I know. basically there's, from person to person, what you notice will vary. Everyone's going to have different signs that they exhibit. Normal aging, I don't want to cover something that's coming up in the next, but people forget things, maybe forget a word here and there, maybe forget where they set down their keys. Typically, they can retrace their steps or things will come to them. But you might notice that things maybe you're not able to trace your steps and find out where you set something down. You're not able to remember directions or follow along with things like you used to be able to. So gonna have any sound? Yeah, unfortunately there's several videos throughout this whole presentation. It's made up mostly of different doctors and professionals who are sharing some great information with us. So I am very sorry that the sound is not coming through. Not had that happen before.
Is it coming on your end?
I hear it, yes, on my end. I don't know why it will not project through. I'm trying to see if there was some way to something was shut off, but I don't see anything. So thank you again for your patience, everyone. So now we're going to sort of go through, first, let's see, they're more expert videos, so we really aren't gonna,
Well, you know what, Rebecca, we could also, if she's not talking, so I think you and I could probably piece this together pretty well, right? So in my background, in my background, folks, hey.
Now I gotta stop it.
Yeah. So I was a recreation therapist on an Alzheimer's unit for a number of years. So I have a lot of experience working one-on-one, hands-on with people who have had dementia in their families. So there you go. You've got dementia here, Rebecca, or do you want me to take that?
Yeah, so there's different, of course, it's going on my end here. Let me just shut the volume off. So there's different types of dementia that they just showed there. Vascular dementia, Lewy bodies are a couple examples. And
Alzheimer's disease. So this is
Dr.
all those
Salloway, or Dr. Hartley, I'm sorry, was talking about causes Alzheimer's, some of the plaques and things happening in the brain that are causing it, and important signs. I can get to the next page here because it sort of will take us through. Can you still hear me?
We got you, yep.
Because I can't hear you now. Okay. So as long as you can hear me. So the 10 warning signs of Alzheimer's. And again, I think not, they may have video. Not all of them though. So memory loss that disrupts daily life, forgetting important dates, events, repeatedly asking things over and over again, relying on a lot of different aids to assist you, lists, notes, asking family members or friends to remind you, versus typical age-related memory issues might be occasionally forgetting someone's name. I do that often myself. I'm terrible with names. Forgetting appointments, but then remembering them later. Those are more common, probably things that we all experience. changes in planning and problem solving. So possible signs of dementia include the ability to work with numbers, follow plans, pay bills. That's often one that is seen. Difficulty concentrating versus a typical age-related change would be, the occasional error in paying a bill, maybe paying too much, or maybe not balancing it exactly as you did.
Rebecca, can you hear me now?
I can hear you now.
Okay.
Can you hear me okay?
Yep. So
Okay.
another thing too here as we're talking, it's probably going to hit on there. I should probably wait till the end here, but I noticed like what I've seen too is I'm watching, tasks. So a multiple step task is something that someone with dementia also struggles with. So if I just say, okay, just take this book, put it on the table, that's fine. But if I say, take this book, go to page 37, highlight paragraph 3, then put it on the table, someone with dementia, that's going to be way too hard. So a multiple step task is also one of the signs.
Good point. Thank you. So difficulty completing familiar tasks. So possible signs of dementia might include, driving to the store that you've always gone to, familiar locations. You might not be able to get there. You can't remember how to go or get back home. Organizing something like a grocery list, remembering the rules to games, versus a typical age-related change might include using your remote, settings, changing your clock setting, or some of the things we all seem to have a little difficulty with these days with all the technology. Anything else that you can mention, Sam?
Yeah, no, absolutely. Technology is changing so fast that I'm just like so psyched when I see everybody on Zoom or figuring things out in the program. So I'm like, yes, it's difficult. So don't beat yourself up when you're trying to get onto these virtual programs. It's a challenge for all of us. So that's normal.
Oh, yeah. It is for sure. Confusion with time and place. Possible signs of dementia when it comes to this is having trouble understanding if something's happening immediately, when it's going to happen, forgetting where you are or how you got there, maybe how to get home. Typical age-related change, confusing the day of the week, and then you realize what day it is. That happens too, like when we have a holiday and you might have a day off from work and you come in and you think it's a Monday, but it's really Tuesday. But let's see. Trouble understanding visual images and spatial relationships. So someone with dementia may have trouble with balance, gauging contrast with things such as steps or what's another one, Sam, that might be when it comes to the spatial, besides like steps?
There is falling
or contrast, yeah.
Yeah, a lot of falls are pretty common actually in people with dementia too. Mm-hmm.
And trouble reading, because keeping track of what you've read and continuing on, that becomes problematic and it's not something that they're able to do enjoyably. Typical age-related changes might be more physical, such as vision changes, cataracts, for example. So new problems with words, speaking and writing, stopping in the middle of a conversation and not being sure how to continue, remembering what you said, repeating oneself, grasping for words, not knowing the proper words to use, having trouble naming things or people, using wrong names for items. There was a gentleman who's the video here. He was someone who always worked with words. I believe he was a writer or an editor. And I know he had given his sort of personal experience in the video about how he started having a lot of trouble with this. And it was really painful for him because it was something he did his whole life. It was so easy for him. And then all of a sudden it became so challenging. Versus a typical age-related change, maybe just having trouble finding the right word, but something will come to you. Misplacing things and losing the ability to retrace your steps. So a person living with an Alzheimer's or dementia may put things in unusual places, and then they won't remember or be able to go back and trace their steps to figure out where they might have put them down. This can lead to accusing people of stealing. This might occur more frequently as this happens. I've seen that myself with clients in the past where this becomes a problem, and they do think people are taking things from them. And then ultimately we're able to find them later on, but it can be frustrating for not only the person with the Alzheimer's, but the family too as well, trying to solve this problem. And typical age-related changes, misplacing things, again, but you're able to find them. You put your keys down on a different table, but you're able to remember after a bit where you found it, retrace your steps.
You go to the freezer and say, oh, look, there's my glasses.
Yes, I've done that. I put the milk in the pantry and the cereal in the fridge.
Normal.
These things happen.
Normal.
Yes. Decreased or poor judgment. So possible signs of dementia may include issues when it comes to money. Sometimes they can be, I've seen this with someone where they became more susceptible to scammers. So they were getting someone contacting them for money, and they felt threatened, and they would follow through. And thankfully, with this particular individual, the person at the post office was really on their toes, and the flags went up because this person came in and they said they needed to buy some money orders or some other things, and they didn't think it felt right. And unfortunately, after some more investigation, they were being contacted and trying, thinking they were doing something they needed to do and give money to someone they shouldn't be. So another problem could be less attention to grooming and cleanliness versus someone just having age-related changes. You skip changing the oil. It's one of the examples here. That might just be something because it's who likes to do that. Withdrawal from work or social activities. So someone living with dementia, they may be withdrawing from things that they used to enjoy, meeting with friends, engaging in social activities, or going to church, or other things that they used to do because they're having trouble following along, and they're not keeping up with the sports team they always used to follow or clubs they used to belong to. So those might be some red flags. Versus a typical age-related change might be just someone not interested in attending a certain event or engagement. Changes in mood and personality. So some potential signs of dementia include becoming confused, suspicious, depressed, fearful, or anxious, getting easily upset when they're out of their comfort zone and not being able to get their bearings as they used to be able to. Versus typical age-related changes might include, your routine's disrupted and you get a little grouchy about it. But I was trying to think what that video might have said, but I, without putting it on, I don't remember exactly this particular video, but I wish you could hear all these videos because they're really great to hear from the experts and some actual people going through the experiences and sharing their personal stories.
And I can tell you, Rebecca, I've seen like numerous times how families would come in and say that Jesus just isn't my mom. This is not, my mom was just this really sweet woman, and now she's just combative and argumentative. And I mean, people have seen complete like 180 switches in personalities. It's sad.
Hard.
But,
I know. It's really hard on the family. And to know how to go about dealing with that and some things they can do.
Mm-hmm.
So the next, I think there's another group of text messages here between the siblings when it comes to their mom. I can read those. And Dr. Salloway, the video here, I'm just looking to see if it really will.
In general, when would somebody know when
Right.
it's time to contact a professional?
So I think that he's basically one of the main key points here is that individuals have different different signs and warning signs, and that you can't just take one. You really have to look at the whole picture. There might be multiple behavior changes. They're a guide. Those 10 warning signs, they're not meant to just zoom in on one and take that as a problem, but it's important to discuss any changes that you do see with the person and even with their doctor, more importantly, and get some suggestions on how to approach it.
And I would say too, a lot of people, like if you're on new medications or you've recently had surgery, a lot of these symptoms can mimic,
Yes.
So it could be a medication thing, a side effect of medication. Something else, of course, I didn't write that note down, but
yeah, or UTIs are another one that
UTIs are huge.
Yes.
Yeah, some kind of an infection going on. And even actually when I did work on the Alzheimer's unit, when you found that somebody did have a UTI, it exasperated those symptoms exponentially.
Yes,
so
it's incredible.
Mm-hmm.
Yeah, and not expected. I know people are surprised by that. That's one of the
like the most common triggers of
yeah.
So I do encourage people to look at their medications and see what side effects, if they're like, geez, this I keep forgetting. People have theories too, like diet sodas or something that are, not good for you, and they create memory loss. So, just notice, like, I'd say if there's a change in their routine of what somebody's doing, if they're doing more of something, it could be an underlying factor.
Yeah, no, that's a great point. Just to recap the 10 signs, that they're a guide to identify potential problems. Someone may experience one or multiple of those signs. And again, important to see your doctor if you do notice anything and discuss it with them. The importance of early detection. So, so we're not going to obviously listen to the expert, but what did Mary notice? So, they noticed some things that were happening with their mom, with her not being as tidy and orderly as she once was, and forgetful. Family and friends are often the first people to notice changes. So they're giving us here 10 steps that can be used to approach memory concerns with your loved one. So the first step would be to jot down what changes in memory, thinking, or behavior that you see. Anything that's of a concern that you've noticed, definitely good to put that down. Anything else going on, sort of like you were touching on, Sam, any changes in routine, medication, any recent medical problems, anything that might be going on, any stressful events, things that can be triggers.
And actually, right now, too, with the current pandemic going
COVID,
on,
yeah.
oh, it's a huge concern for people, you know, with the social isolation and the lack of stimulation. So unfortunately, I think a lot of people, if they did have beginning signs prior to COVID, it's probably accelerated quite a bit more than it typically would.
I know. Learning about the signs and benefits of early diagnoses. Speaking with other people in your family, other friends, if they've noticed any changes, anyone that might have regular contact to see if they've picked up on anything, and share some of the things that you've noticed, and have a conversation. And the tough part is maybe who's going to bring these things up and start that conversation, bring up these concerns. It's not an easy thing to do. And where's the best place and what's the best time? You certainly want it to be a comfortable, safe place. And what will you say? How do you bring things up and go about it so you're not making someone feel defensive? And offer to go with the person to the doctor. I mean, I think this is great in any case, often, because you forget what you want to ask the doctor once you're there. So having your questions prepared in advance just help keep you on track and get the answers you want. But then when you're in the office, doctors sometimes throw so many things at us quickly. And if you're there by yourself, it's hard to really remember what they told you once you walk out. So if you bring someone with you when it's warranted, you can take notes and really have a good recollection of what the doctor was telling you in your appointment.
I think
And
that's
of course,
just a good practice if you're able to in general too, you know,
yes.
Again, with COVID, they're not really allowing this, but there are
No.
video calls that people are able to, you know, but different people hear different things, and we all pick up something else that somebody else may have missed.
That's
so.
very true. Yes. I know it is funny how that works.
Mm-hmm.
And if needed, have multiple conversations. Certainly one conversation, you're not going to be able to really cover everything, and you'll definitely want to keep that an open dialogue and keep those conversations going with the family, with the doctors, and reach out for support. So your primary care physician might be one, but the Alzheimer's Association is a great resource that can help point you in different directions or provide support and education. There is support out there. See a doctor. So when you do have concerns about someone that you think might be exhibiting signs of Alzheimer's or dementia, the primary care might be the best first step, and they may refer you on to someone else for further assessment. And some of those specialists might include a geriatrician, a neurologist, a neuropsychologist, a psychiatrist, or a psychologist. And maybe depending on the situation would be sort of the direction your primary care might point you in.
Looks like the end of it. Is that the end?
No, I didn't think that was. Let me just see here. No, there was some more, but I don't know. Let me see. I don't want to X everybody out. Okay.
Okay, so we do have a question here. Do people self-identify and seek help? And then, this would be a brave thing to do, that's,
Oh, definitely. Because I think people do, I mean, I know myself, and probably you have had people say to you, boy, I've really noticed a change. I'm a little more forgetful. I'm having trouble paying my bills. People do tend to sort of pick up on some changes they're having with themselves. And so it is a brave step to go and talk to your doctor about it. It's scary, but I think I would certainly encourage someone to do so.
I agree. There is a book out there, and I don't know if this mentioned this, and I remember when it first came out, the book is called Still Alice. I forget who the name of the author. Yeah.
That's an excellent book.
And I think from what I had heard, like when it came out, people said it is just so true because it was written from the perspective of the person who was just developing the dementia.
Yeah.
So I think they maybe even turned it into a movie, I feel like. Yeah.
They did. Yeah. It was good too, but I would recommend them both, both.
Yeah.
Read the book first.
Yeah.
And then
so if anybody's like, hey, wait, it's another, if you just want to watch a movie, go.
I know. Yeah, no, but it's good.
Mm-hmm.
So she was going to tell us about the benefits of early detection. So just to recap what she said is to pay attention to any changes that you notice in memory, thinking, or behavior in yourself or others. And if you see any of these changes, have a conversation about it. That's difficult. And again, going back to those 10 steps on how to maybe approach that and speak about it. Some of the benefits of early detection include planning for the future, treatments, being able to participate in any clinical studies, get support groups, and help with the journey along the way so you don't feel alone.
And I do have to say, a lot of the medications, again, this was like several years ago that I had worked on that unit, but a lot of the medications were only available if you were so far along in the phases. So people are like, oh no, I'll just wait till it gets worse, is not necessarily the right approach to take, because a lot of the medications can kind of hold people where they are at that stage.
Yeah, and they're always coming out with new advancements. So
yeah,
I mean, that's wonderful too.
Mm-hmm.
It's like another video. Oh dear. Okay, so testing your knowledge. Little quiz. So true or false, there is currently no way to diagnose Alzheimer's disease. Any?
Oh, well, it used to be an autopsy was the only way, is what
Right.
I knew. It used to
right,
be.
I know. Well, let's see. Nope. There's a number of assessments and tests that make it possible for professionals to diagnose with a high degree of certainty. I don't think anyone can really definitively say without that autopsy, but I think now with all the advancements, there's many more assurances. So some of the assessments and tests that are available are your medical history, a physical exam, screening for depression, an interview with those close to you, some testing, lab tests, mental and cognitive status tests, and brain imaging. So those are some of the things that someone might experience.
And the question that we have here is, does insurance generally cover the costs for meds for dementia? So Rebecca. in your experience. Yeah.
I think, I mean, I would like to say, you know, depending on age and insurance. So if you were of Medicare age 65 or above, certainly it may be covered. The cost, you know, again, is going to depend on what your prescription drug plan is. So there's some variables there, but making sure any medications you're on are covered on a formulary for whatever Advantage plan, drug plan, insurance plan, depending what you have, is important. But it's too hard to answer that, you know, without knowing exactly specific details about the individual's coverages, unfortunately. And
that's something you can always ask too. You can always, you know,
oh yeah,
call
you
your
can
insurance.
call your insurance company. Yeah, for sure.
Yeah.
And even
always
if
ask.
you're talking, always ask. And if when you're sitting down with your physician and they're recommending this medication to you, certainly that's something you can bring up, because they would most likely have a good idea about that as well.
And I find it's funny, a lot of doctors, I don't think they're aware of the cost of some of the medications.
No.
I know I had to be on a medication and I said, wow, that's a $300 medication. And they're like, wow, really? Yeah. So I don't think they're necessarily aware of the costs of these things. So between, you know, asking your doctor if there were any like generic medications, you know, you can always ask that question too. And then certainly your insurance company.
No, you're right. That's true. I've seen that happen. If you don't ask, you know, it never hurts to ask, for sure. So do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? Here's some more text between the family. Oh, and now we would have a video from Dr. Soloway, but we're going to skip that video and to talk about a recap here. So a diagnostic experience is going to vary for each person, depending on the symptoms you're exhibiting and what your doctor really feels will be the best route to go. And as we touched on earlier, it could be something other than Alzheimer's or dementia that's causing the symptom. And there are stigma and misconceptions about the disease, like believing that nothing can be done, and that might prohibit someone or prevent them from seeking a diagnosis, but that's not true. So certainly, you know, there are things that can be done, and it shouldn't stop you from trying to speak to your doctor and pursue getting that diagnosis, because the earlier you can get a diagnosis, the better. More text messages here. So their mom did get a diagnosis of early stage Alzheimer's. And as they're mentioning, the Alzheimer's Association does offer free resources. And so they're a great place to go for help. And hear all that. But so the Alzheimer's Association, they have a 24/7 helpline staffed with real people. So you'll get a live body you can talk to, which is always nice. And they have a fabulous website with lots of great information as well. And they're in your community, so they offer community education. Unfortunately, due to COVID, the support groups that were in person have moved virtually, but they do seem to be going well in that format, and people are utilizing them, which is excellent. So there's different things out there that people can go to for help. the Alzheimer's Association has the walk. I'm sure you noticed the signs all about, especially September, October, and they do lots of advocacy work at the legislative offices, and they do trial matches. So they're out in the community, and they're always trying to advance the research on Alzheimer's and dementia. There. So again, were there any other questions? And I do have to say that I apologize for all of the technical difficulties that we had today, and thank you for hanging in there. But I hope we were able to cover at least lots of the basics in there ultimately throughout the presentation.
Well, thank you, Rebecca. I'm going to end this on Facebook Live, and then we'll continue our conversation if anybody else on Zoom has any questions, okay? And if anybody on Facebook has any questions that they want to type in and chat, or you can contact Rebecca. And Rebecca, the best way to contact you is?
Our number here is 860-870-3128.
Okay, and your email?
My email is R, like Rebecca, and my last name, Stack, STACK, at Ellington, ELLINGTON -CT.gov. So rstack at Ellington-CT.gov.
All right, awesome. Thank you very much, Rebecca. I'm going to end us on Facebook, and thank you.
Thank you.